Hi, I'm Dr. Clark Perry. I'm the Medical Director for Service Excellence for CPN. We wanted to create a video to help some of our providers improve their CGCAP scores. While we talk a lot about CGCAP scores and we place a lot of emphasis on those scores, we have to remember that they are just merely a number. But they're a number that kind of reflects on how well we interact with our patients. While we want to improve our scores, really the main goal is to create a culture of patient-centered care. We really want to create an atmosphere in our offices where we kind of predict the needs of patients, understand their needs, and help them through the journey of healthcare. So in the first video, we will be talking about the why. In the second video, which will be done by Sweatt, we'll be talking about empathetic communications, how to improve our communication skills with patients. Then last, I will be giving a third section on key phrases, key actions that have been really shown by others to be instrumental in improving their own CGCAP scores. So let's start with the why. I would encourage you to look back and think about why you went into healthcare. Why did you become a physician? Why did you become a nurse practitioner or a physician assistant? I look back in my own interview into medical school some time ago, but I don't remember exactly what I said. But I'm sure I said something along the lines of, I want to become a doctor because I enjoyed people. I wanted to become a physician because I cared about people and I wanted to help them. I'm sure many of you said maybe the same thing when you interviewed. So again, as we talk, I want you to think back as to why you went into healthcare and what's important. Author and consultant Simon Sinek has studied several organizations, several leaders, and has determined that there are three elements to almost every organization. The first is defining what they do. And Simon Sinek found that almost everyone can tell you what they do, whether it be sell automobiles, whether it's sell hamburgers, or whether it's healthcare. Most people can tell you what they do. A few people can tell you how they do it, but only a small portion of people maybe can tell you why they do what they do. Now, when I say why, I don't mean to make a profit or to make money. That's an outcome. The why is your gut reaction. It's your own mission. It's your calling. It's why you do what you do. Well, Mr. Sinek found that when he studied these corporations, studied leaders, that those who were truly successful, instead of starting with the what, started with the why. Let me give you some examples. The Wright brothers. There were several other people at the same time as the Wright brothers trying to build a successful flying machine, an aircraft, an airplane. But the Wright brothers did it with passion, and they had a lot of followers. Martin Luther King is another example. Martin Luther King was a minister. People didn't necessarily follow Martin Luther King for what he did as a minister. They followed Martin Luther King because of why he did what he did. In fact, we think back in January, I believe, in 1963, and during Martin Luther King's speech in Washington, D.C., he didn't say, "This is what we're going to do," or "This is my plan." Martin Luther King said, "I have a dream." And people followed Martin Luther King because of his dream. So in studying these corporations, Simon Sinek has designed what he calls the golden circle, and that is the why. And he's coined a phrase of saying, people don't follow what you do, they follow why you do it. Or saying it another way, people don't buy what you do, they buy why you do it. Let's think of a coffee shop. There are many places you could get a cup of coffee these days, but there certainly is one coffee shop that seems to be more successful than the others, and that's Starbucks. Starbucks started as a small coffee shop in Seattle, then decided to expand nationwide. And when they decided to expand, they knew they had to do more than just serve coffee. If we look at Starbucks' website, they clearly say what their why is, what drives them. They say they brew millions of cups of coffee each day, but each interaction is unique. They also say on their website, expect more than coffee. We are a neighborhood gathering place. We're so much more than what we brew. It's a connection. So again, we have many places that we can buy a cup of coffee. So why do many of us choose Starbucks? Not because of the coffee, I would say. And to again say what Simon Sinek has coined, people don't buy what you do, they buy why you do it. So how do we relate this to healthcare? Certainly healthcare is very competitive in this city, very competitive in this state. So how do we offer something different? Well, to get to our why, I looked at our vision statement. To simply deliver an exceptional experience with every life we touch. Nicely written statement. Certainly drives us through what we do each day when we come to work. But I'd ask, what is the exceptional experience? Every hospital in this city is working on the patient experience. So it's easy to say, but how do we define it? Well, to answer that question, I looked at my friend Andy DeLalo. Andy works for GE Health. He has run several different oncology hospitals. Andy had written a paper for the Mayo Clinic Center of Innovation, and in that paper, Andy asked the question, are we designing the wrong patient experience? Many people think that we should pattern ourselves after Disney. There is, in fact, a book written, I believe it's entitled, What If Disney Ran Healthcare? Other people think that we should possibly pattern ourselves after the Ritz-Carlton. Now, why these companies certainly have great points in terms of customer service, and we can learn from their experience and teachings, I'm not really sure that's what patients want. And that's what Andy said in his paper. It's not the Disney experience, it's not the Ritz-Carlton experience. But if it's not that, what is the patients want? And what Andy says is connections. It's connecting to us and us connecting to them. And I think it really sums up the patient experiences. And I think that when we look at CGCAP scores, I think it's nothing more than a measure of how well we connected to a patient and how easily we allowed them to connect to us. It's about connections. And these connections are very important. So if we take our own mission statement and some of the phrasing from Starbucks, we might want to say at Community Health Network, expect more than healthcare. We connect. We connect to patients on a personal level that enhances health and well-being. I think if we really strive for this, and I think we really can, we can be successful, and this can be our competitive advantage to the other networks. People can go anywhere for healthcare. They can choose any network. They can choose CVS. Patients can choose Walgreens. So it's not just healthcare they're shopping for. They're shopping for a connection. Again, people don't buy what you do. They buy why you do it. Well, connections are extremely important. We know that providers who communicate well, connect with their patients, those patients have better health outcomes. We know in patients who have diabetes, the A1Cs tend to be lower in those providers who communicate well. We know in patients who have hyperlipidemia, if their providers communicate well and connect, the LDLs tend to be better. We also know patients with osteoporosis tend to be more adherent to taking their osteoporosis drugs if the provider communicates and connects. So extremely important in terms of health outcomes on how we communicate and connect to our patients. Lower malpractice risk is also associated with those who communicate well. Approximately 75% of all malpractice cases are believed to be traced back to poor communication. Either the patient felt ignored, they felt rushed, they felt a physician or provider didn't explain things well. 75% of cases. So if we want to reduce our malpractice risk, I think I think it's very important that we learn to communicate with our patients. Decrease provider burnout. Extremely important topic these days. Everyone's concerned about provider burnout. And I think the provider burnout has a lot to do with we are being asked to do much more these days. We're being asked to be involved with the use of medical records, electronic medical records, meaningful use, things that many of us really didn't sign up to do when we went into medical school. So if we go back and concentrate on the reason we entered healthcare, and that was to connect with patients, getting back to why we do what we do, then it increases job satisfaction. Sometimes it's the most enjoyable part of my practice is really getting to know patients. So again, we can decrease provider burnout by connecting to our patients. Improve safety. If patients know that they can communicate with us, they're more likely to bring up concerns, questions. This is particularly important in the hospital. I think if they can communicate with us and our nurses without fear, more likely will we provide safe, good quality care. Lastly, loyalty and growth are increased in those who communicate well. When patients are asked what drives loyalty to a healthcare network or what drives loyalty to a certain physician or provider, three things are echoed. The provider listened to me, the provider cared for me, the provider explained things well. So many patients can be attracted to this network, but it's very important to each of us. It's important to you, and it's important to me. It's important to the network that we try our best to retain these patients, and we can do so through improved communication. Connections are important also, obviously, to patients. I'd like to read a statement from a mother that had a 19-year-old child with leukemia. The mother says, "Every patient deserves the most qualified doctor, but more importantly, it's the rapport and the compassion that resonates the loudest." So again, I would think back to why you went into medicine. What is your why? What is your own vision? What is your gut? What is your calling? And remember how important it is to connect to patients on a personal basis.
Hi, my name is Sweatt. I'm one of the clinical pharmacists here within the network. And earlier, Dr. Perry talked to us about establishing an emotional connection with our patient. But how do we as providers establish that connection? I made a 5-step approach called the Indeed model that'll help us establish an empathetic, patient-centered, communicating relationship. But before we start into the Indeed model, we have to know 3 basic principles. One of those principles is empathy versus sympathy. Empathy is whenever we put ourselves in the other person's shoes, rather than sympathy is drawing a silver lining around a certain situation. It's important for us to have empathetic responses rather than sympathetic responses, because that allows us to make sure the patient knows that we hear them and we understand where they're coming from. Another element that we need to understand is patient-centered care, which is simply responding to a patient's needs or wants so that they can make an informed decision on their clinical situation. Lastly, a patient-provider relationship needs emotional connection, as Dr. Perry was describing to us. It also needs respect, genuine interest, understanding, and commitment. When we tie all 3 of those principles together, we find something called the value of patient-centered care, which promotes satisfaction, adherence, and also self-management, which improves our quality measures, including CGCAP scores. The Indeed model. Now, the Indeed model I want to definitely highlight does not add time to the visit, but simply meaning to the visit. Let's start out with our standard introduction, which stands for I. You can use our network standard of AIDIT, which stands for acknowledge, introduction, duration, explanation, and thank you. The reasoning why we would use a standard introduction is that it alleviates anxiety for our patients, which is one of the largest barriers that we face as providers. The next portion of the Indeed model is nonverbal communication. When we look at communication as a whole and we focus in on speaking only, we actually see that we speak nonverbally more than we do verbally. I've included a common list of nonverbal cues that we as providers can adjust our practices to. A couple of examples that you can use would making yourself at a 45-degree angle between your computer screen and your patient. Another example would be making direct eye contact with your patient and also becoming eye level with your patient rather than standing over a patient. This will alleviate two of the biggest barriers that we have as providers, which will allow us to discover what our patient needs more readily. I've listed here a couple of common questions that we can use. And I've also listed for your reference open-ended questions and restating and clarifying questions that we can utilize within our visit. Again, we are not adding time to the visit, we are simply adding meaning to our visit. The next portion of the Indeed model is EE, employ empathy. Again, looking at how we communicate as individuals and we focus in on listening, we actually find that we as providers don't typically listen as much as what we think we do. The reasoning why is because we've been trained to take notes or listen for facts. In fact, we typically only get down to a level 4 where we have focused listening, which just simply means we're making direct eye contact with our patients. I challenge us to go a little bit deeper with our listening skills on level 5, 6, and 7, where we actually have interpretive listening, interactive listening, and then engaged listening. This will allow us to employ empathy more readily, which includes all of the following details on your slide. And our patient will finally come into full color. After we employ empathy for our patient, we find that we have a developed patient-provider relationship, an established connection that will improve knowledge, improve their decision-making skills, which promotes self-management and adherence, which leads to better outcomes, including your CGCAP scores. Next, Dr. Perry will be providing us action steps so that we can better employ the Indeed model.
Hi, welcome back. I'm Dr. Clark Perry. This is the third segment of our videos talking about connecting to patients and how we improve our CGCAP scores and improving the patient's perception of care. In this segment, we're going to talk about key actions, key phrases that have seemed to be very helpful to many of us in terms of improving our own CGCAP scores. So they've been proven, they work, and they're really easy to do. Last year, roughly 9 to 10% of patients scored us as an 8 on a scale of 1 to 10. And if you recall, on the CGCAP scores, only 9s and 10s really matter. So 8s really equal a 0. But 10%, roughly, scored us as an 8. So in this section, we want to think about ways that we can wow those patients. What can we do that maybe no provider or no physician has done or said to those patients before? What are little things that we can do that a patient, when they get that CGCAP survey, would say, no, this physician isn't an 8, this physician's a 9, this physician's a 10. So again, I think these are little things, they're easy to do, and hopefully you'll find benefit. If we want to concentrate on patients' perception of care, we have to think and ask, how do patients judge physicians and how do patients judge providers? When they think of someone being outstanding, what comes to their mind? Several years ago, a survey was conducted at the University of Chicago along with the Associated Press, and they asked over 4,000 patients, when you think of a high-quality physician or provider, what comes to mind? What do you think of? Nearly 2/3 said it's the personality traits. It was the patient's bedside manner. It was the patient-doctor interaction. Now, certainly they wanted someone who was competent, but it was the interaction that seemed to be the most important in terms of defining who was a high-quality physician or provider. If you look at the survey more closely, and again asked what came to top of their mind when defining a high-quality physician or provider, the number one answer was a provider who listened, a provider who was attentive. So that was the single most important quality of any physician or provider, one who listens. And obviously they want someone who's competent, like I said, and someone who cares. But it's also a person with a good bedside manner. It's extremely important to these patients. Another survey was done a little closer here into home in Indianapolis, and roughly 500 patients were asked a series of questions, but one particular question I found interesting was, in the next 12 months, how likely are you to leave your primary care physician? Interesting question to ask. And somewhat surprisingly, at least to me, was that nearly 20% of the respondents said they were at least somewhat likely to leave their primary care physician in the next 12 months. And I think that number is staggering. Think of 20% of our population base left. That would create a huge impact on this network. So obviously, if you think roughly 20% of our patients may leave within the next 12 months, obviously the next question is asked is why? Why would you want to leave your primary care doctor? Well, maybe not surprisingly, the majority of respondents said they were moving. It was no longer convenient because of location. Some said that they changed healthcare plans, that we were no longer in their plan. But if we take those out of the 20%, what are the other reasons that a patient may consider changing primary care physicians? Nearly 20% said it's because the physician didn't listen. So again, listening is extremely important. Equally concerning is 20% said they were going to leave because the physician was always late. Running late is no longer acceptable in today's healthcare market. Other concerns were rude front office staff, rude nurses, rude physician. But the point here I want to make is, again, patients identify a provider who listens as being high quality. Now also you notice on this slide, it wasn't because the physician prescribed narcotics, it wasn't because the physician didn't prescribe a certain test. Listening, most important. So what I'm going to do is give you some thoughts, some suggestions that when you're meeting patients in a hospital or in your office, things that you may be able to incorporate in your visit that are really important to patients and really elevate their perception of care. Now, I'm not trying to do things to add to your time of your day. I'm not trying to prolong your patient visits. I'm actually trying to find ways that may make you more efficient and decrease callbacks from patients later that same day or later the next day. We're going to go through a series of points, and I would encourage you to write down every point that I talk about. Then at the end, I would maybe choose one or two things that you identify on this list that maybe you currently aren't doing, and maybe incorporate that into your daily visit. I would encourage you to find one or two things to incorporate with every patient, every visit, every time. I divided this segment into three. One is kind of the pre-visit. Then we'll talk about what to do during the visit. Then at the end, we'll talk about how to conclude the visit. So first, I talk about exceptional connections. And this is by design, because this requires some work on our part. It may not be natural for all of us. So how do we establish those connections? So before going into the patient's room, I think it's very important to first review the chart. If nothing more, to know the patient's name. You want to know the patient's name before walking into the room. I think it's important to know why the patient's there. Hopefully your medical assistant has entered in their chief complaint so you know why they are there. But I think it's also important to review maybe what was done at the last visit so you know the patient. Again, if we're going to connect with patients, we have to know them on a personal level. So after reviewing the chart, before walking in, extremely important to knock on the door. Maybe wait 2 seconds before entering. Show the patients respect and give them some privacy, particularly if you have them change. But again, I encourage everyone to knock on the door and wait before entering the room. When entering the room, make eye contact. Smile, greet everyone in the room. If someone's in the room that you may not know who they are or may not know the relationship, I'd suggest asking the patient who they brought with them. This may prevent some embarrassing moments. Ask them. One thing we are trying to work on with Epic is to include on the patient banner the preferred name. Some patients, like myself, go by the middle name, and we may not know that unless it's entered on the banner in Epic. Some people want to be called Mr. or Mrs. Some people have a nickname that they want to be called. The important point is that if we truly care for our patients, our staff's going to ask, and we're going to use that name that they prefer. So again, these are points maybe as you get ready to begin the visit and as you walk in the door, how to greet the patient. Once in the room, I suggest touching the person before touching the patient. And what I mean by that is connect to the person before dealing with their medical concerns. Recently, I discovered on Epic the use of sticky notes. Many of you may have known about the sticky notes long before I did. The sticky note is found on the banner, I believe at the upper right side. And if you don't know where the sticky note is located, feel free to contact me. I'll walk you through it. But the sticky note is something you can enter as personal information, and only you will see it. It's not transferable to other providers. But I like the sticky note because I place personal information on that sticky note. Say a patient tells me they're going on a vacation. They're going on vacation to the Outer Banks. I'll enter that in the sticky note. The next time I see the patient, I'll say, "Oh, I remember the last time you were here. You said you're going to the Outer Banks. How was your vacation?" Another example is a patient described the difficulty they have with their mother who has Alzheimer's. I entered that in the sticky note. So when the patient comes in, I asked, "How's your mother? I remember she had Alzheimer's." So again, very important to connect to the person before connecting to them as a patient. Next, I would sit down. Sit down during the visit. Studies show that when providers sit, the patient's perception of time spent is elevated. Studies show that when providers sat, patients overestimated the amount of time the provider was actually in the room. When the provider stood, patients actually underestimated the length of time the provider was in the room. So like I said, I'm not trying to give you suggestions that are going to add to your day. It's making the visit more meaningful and elevating the patient's perception of that care. Number 3, listening to understand. In the earlier video, Whitney talked about communication skills. Very important that we focus our listening skills. Many times we listen, but we may be distracted because we're typing in the EMR. But even if we are listening, how does the patient really know we're listening? I would suggest by facial expressions, whether it be a smile, whether it be raising the eyebrows, whether it be a frown, or maybe just simply saying, "Tell me more." Or maybe also being empathetic and saying, "I can understand how it'd be frustrating." I also encourage providers not to interrupt. Some studies suggest that providers on average only allow patients to speak 10 to 12 seconds before they interrupt them. It's not a very long time. Listening is extremely important to patients. I encourage providers to try your very best to let the patient speak for a minute without interrupting them. I'm convinced the patient is going to say what they want to say. I would rather know at the start of the visit all of their concerns as opposed to at the end of the visit when I'm ready to walk out the door and they say, "By the way, what do you think about my foot pain? Or why do you think my foot is red?" I want to hear the concerns from the start. Now, obviously, this is a challenge in some patients who bring in a laundry list of complaints. And we might need to say, well, we can only address your top 2, top 3, maybe 4 concerns. But the point is, we need to do a better job in allowing patients to talk and not interrupting give them at least a minute to talk. And again, show them you're listening by facial expressions or nodding of the head. I would encourage physicians and providers to communicate your findings during the physical exam. During the physical exam, we are observing a lot of different things, and we record those findings in our mind. We might notice that the eyes are sclera white. We might notice that the thyroid appears enlarged. We may have not heard any bruise. The lungs may have sounded clear, may have been some wheezes. Heart was regular. Maybe there's some swelling in the legs. I suggest communicating those findings to the patient as you're doing the exam. Saying, Mr. Jones, your thyroid feels normal, your carotids are clear, I did not hear any bruise, your lungs sound fine, your heart is regular. There's a little hint of a murmur, but I've heard that before. Your pulses in your feet are strong. There's no edema in your ankles. And again, saying this as we do it builds trust and confidence in the patient. They don't know what we're doing. Doing so gives them an idea of everything that we're assessing. Again, we're not adding time to the visit, we're just making it meaningful. I would encourage you to ask the patient for their thoughts and input, what they think we should do. Many times that if we tell a patient to do something, I don't think the patient is going to receive that very well. If I tell a patient they need to start a statin, they might think, I don't need to do anything, doctor. Why do you think I need to start a statin? Many patients come to us having already read different things on the internet. Maybe factual, may not. But the important thing is to recognize they came to the office with some preconceived thoughts. One patient that I saw that was hypothyroid had obviously done a lot of reading on the internet. So I told her, I said, you're obviously quite intelligent, you're well-read. I'm sure you have some thoughts about what we should do. What do you think we should do? She looked at me and she said, are you serious? I said, yes, I would like to know your thoughts. She said, no provider ever asked me that before. It was important to know where she was coming from. It was important to know her thoughts on what we should do. Now at that visit, she told me her thoughts, and after she was finished, I said, would you like to hear my thoughts? And together we came up with a plan. But it was a team concept. It was the patient and me. It wasn't just me dictating. It was me educating and communicating, but her really making the ultimate decision. So again, I would encourage you to think about asking your patients what ideas they have or their input on what you think you should do. In the visit, it's important to explain things without medical jargon. And it's important to make sure they understood what you said. I believe asking patients to restate what was explained to be important. Another idea is to say, you know, Mrs. Jones, we've talked about a lot of things today. Just so I know I did a good job communicating, can you tell me what we talked about? Another method is to tell a patient, I know you're going to go home and tell your family and friends what we talked about today. Just so we're sure that I communicated well, can you tell me what you'll tell your family and friends? The important point is to explain things well and without use of medical jargon. I would offer the opportunity to ask questions. Many times we may ask, do you have any questions? It's a yes or no question. Do you have any questions? Patients know how busy we are. They saw the waiting room. They may have had to wait for us. So out of respect of your time, when you ask, do they have any questions, they may say no. But when they get home, they end up calling the office, or they may call the next day. Now, I don't know about you, but I'd much rather deal with a question when the patient is in the office as opposed to dealing with a phone note later that day or the next day. So instead of asking, do you have any questions, I would suggest asking the patient, what questions or concerns do you have? Just assume they have questions. And maybe not saying that as you're standing up. Stay seated. Say, what questions or concerns do you have? And if they say none, say, great, then we've answered them all. call back. Patients need to feel connected to us, and they need to know when to call back. They need to know when they should start feeling better. So if a patient's being treated for pharyngitis, maybe we're given an antibiotic, it's important to tell the patient, you should start feeling better in 2 or 3 days. If not, I want you to call back. Or if we do labs, x-rays, saying you should hear from us in a week. If not, call us. I want to make sure you get the results. Maybe if a patient's coming back just on a PRN basis, if you have any questions or concerns, please don't hesitate to call us. Patients need to feel connected to us. Lastly, is thank you. I think this is very important. For some reason, in healthcare, we had the idea that we didn't need to thank patients. Patients are really our customers. As I said earlier, patients can choose wherever they want to go for their health care. We should thank them that come to see us. Competition is very prevalent in this city. So if a patient thanks us, I think we should thank them in return for coming. Or you could say, you're welcome. Personally, what I've tried to say to patients is following the Ritz-Carlton approach. If a patient says thank you to me, I try to respond with, it's my pleasure. It's interesting to see some of the feedback I get from patients when I say that. Again, it's kind of creating that wow factor. It's not adding to the time of my day. Also, we have to know how to accept gratitude. If a patient thanks us and says, "Doctor, you really made me feel better. Doctor, you saved my life." What is our typical response? We say, "Oh, don't worry, it's just my job." You just stole the patient's gratitude. I would encourage you, if a patient responds that way and says, "Doctor, you really made me feel better. You made a difference." I would encourage you to say, "Thank you. You really made my day. I could really use that." Again, doing things that no other physician or provider may have done in the past, creating the wow factor. So when we think about these exceptional connections, it's very important that we know the person. It's the person that we have labeled as a patient, but they are a person, and we need to interact with them on a human basis. And when it comes to the patient experience, we don't need to do things, or nor should we do things to simply please the patient or to simply satisfy the patient. But we should do things to serve them and serve their needs. So we talked before about how connections are important. I think connections are essential. They're essential for each of us to succeed. It's essential for this network to succeed. Is to connect to patients on a personal level. And also, the connections are important because it's why we do what we do. It's why we went into healthcare, to connect with patients. Thank you for watching these videos. Hopefully you found something that may help and you can possibly use in your daily visits. Again, I encourage you to write down maybe 2 points that you'll commit to yourself with every patient, every visit, every time. I think if you find 1 or 2 things that we talked about and incorporate those in your visit, I promise your CGCAP scores will improve. But more importantly, we will truly create a culture of patient-centered care, and we will create something that no other network can, and we will all succeed. Thank you.